The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanic, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello, TMD warriors. We are here for the next Tuesday morning episode of TMD Demystified. I am Tony Urbanic. We'll get right into it. Today, we are going to continue the series of presentations or discussions about value-based TMD, TMJ treatment. Value-based TMD, TMJ treatment. We're not really far afield on the topic of TMD, TMJ. And the reason that I emphasize this at this time is we really have solved the problem that was unsolvable for 50 or 60 years, which simplified, and I've said this innumerable times, everyone else was looking at trying to solve the symptoms rather than the cause. And if you just concentrate on symptoms, well, you may be able to affect some symptoms if you have the right hammer or big enough hammer or whatever. But if you actually address the cause of the symptoms, then you don't have to address the symptoms. You just get rid of the cause. It's just that simple. And that is what I didn't discover. It's just common sense. But I realized, put the dots together, that the cause was inflammation within the temporomandibular joint, which causes each and every symptom. This is so simple, it stunned me when I realized it. And of course, I take full responsibility. I was doing symptom surgery for 36 years, and everyone else was doing some kind of symptom treatment rather than addressing the cell biology of, or just generally speaking, inflammation. And inflammation is nothing more than a series of cell biology steps. But you don't have to get complicated about inflammation. If you can just get rid of the inflammation, then the symptoms go away. All right, that's the basic of what I quote, didn't discover, was already there, and a bunch of common sense. But I continue to think about the problem and investigate the best way to deliver this to patient, and that's when I ran across, in my reading experiences, the great, what I consider, my opinion, the great book, and he has a second book, but book written by Dr. Robert Pearl. And this episode is a continuation of my discussions about Dr. Pearl's insistence and description of and definition of value-based treatment for medical care. Value-based treatment for medical care. And TMD, TMJ truly is a medical problem, a medical treatment, especially if you're treating inflammation. It's a medical thing from the general concept point of view. It's given to dentists to do because the medical doctors didn't want anything to do with TMJ for kind of obvious, but screwed up reasons, and it fell into the lap of dentists. And dentists, for example, dentists are dentists, and they're used to treating teeth. So for years and years and years, the treatment of TMD was doing something to the teeth themselves. Occlusal equilibration, occlusal reconstruction, orthodontic treatment, Even orthognathic surgery, and it does have an effect on the temporomandibular joint, but only if it diminishes the inflammation within the joint. All right, enough prelude. The value-based TMD treatment topic today is part 4. If you're going to have a value-based treatment, according to Dr. Pearl, it should have minimal side effects and unintended consequences. So a treatment of any kind, in this case specific to temporomandibular joint care, temporomandibular joint treatment, along with other parameters that we talked about previously. The fourth one in line is part 4, should have minimal side effects and unintended consequences. And it just works out that an oral device that separates the posterior teeth, unloads the temporomandibular joint adequately to decrease the inflammation within the temporomandibular joint, like a set of crutches, decreases the inflammation within a inflamed or damaged knee, will make the symptoms go away. Now, if you want to stay on crutches for the rest of your life, it would work. But this device basically is the equivalent of crutches for the temporomandibular joint, and it's not hard to stay it on the rest of your life, stay with it, or stay on the protocol for the rest of your life, because almost everybody, most people just have to wear it at nighttime the rest of your life after they get through the first 2 months, which is 24/7. It's just too simple. But again, not only is it effective, and not only is it simple, but you want a service which has minimal side effects and unintended consequences. And that's why we're going to compare, and I won't spend much time promoting this device, just to say that it is pretty simple. The unintended consequences are very, very limited. There really aren't any surprises. If you use it correctly, it doesn't move teeth. If you use it according to the protocol 24/7 in an adult, you do not get posterior supereruption of the posterior teeth in an adult within 2 months, and that's why the 24/7 is limited to 2 months. So you can't get tooth motion. You can't get supereruption of the teeth by separating the teeth just for 2 months, because they're chewing. It's 2 months, 24/7, except when you eat. So they take it out when they eat, they're chewing. You're not going to get supereruption in an adult in 2 months. Adolescence is less. You can get supereruption, and you have to be very careful. And we discussed that. That is a variation. But so we'll just say that, and the only thing that you do observe, which is somewhat stunning, but expected in patients who have significant CO-CR discrepancies, that is a difference between centric occlusion and centric occlusion, centric occlusion and centric relation, CO and CR. If it is large enough, you will see the mandible drop back, and you can have what looks like an open bite or what looks like posterior prematurity, but really what it is that they started out with a jaw growth problem that had an adequate CO-CR discrepancy, which is actually a CO-CR discrepancy is a functional malocclusion, and functional malocclusion is one of the 3 causes for damage to the temporomandibular joint, creating inflammation and damage. All right. I hope you follow that along. So I want to get into this and not make this episode last too long, because I want to make some points, which in preparation for this episode actually surprised me. I knew what I'd find. I'm not overly surprised, but basically what I want to do is I want to compare what I just talked about as the expected side effects known and expected side effects of using an intraoral device that separates the back teeth, and unintended consequences from what else is out there to treat the symptoms of TMD. So let's just get into it. I just picked out a few of the most prominent treatments, routine, and compare what I just talked about, what I just told you about the expected known side effects or unintended consequences using an oral device, separates the back teeth according to protocol, in comparison to a few other things that are used routinely, and you'll recognize all this. So as an example, if a patient goes into a major medical school and medical hospital establishment, major medical group here in Nashville, Tennessee, which I will leave unnamed, in their Department of Oral and Maxillofacial Surgery, the first thing that will happen is they will be prescribed muscle relaxants, and muscle relaxants are almost exclusively, in almost all cases, whether it be a walk-in clinic, or a general dental office, or even an oral surgery office, the most prominent treatment for a suspected case of TMD will be muscle relaxants. So I just want to reel off what the unintended consequences or side effects of muscle relaxants are. I thought I was going to run to 4 or 5 of them. And the point is that in defining value-based care, it is critical. It is the standard of care to make sure that your patient is aware of all the unintended consequences. In our case, the Urbanic device and protocol has those criteria, which I mentioned earlier, spelled out in the consent for treatment and in the package insert. In both places, it spells out exactly what the things that can happen when you use the device, which I've already talked about. It doesn't allow movement of the teeth. You do see in 5% of the cases that already have a big COCR discrepancy, you'll see the mandible fall back, and you'll see a significant difference, or even an anterior open bite, which needs to be addressed either orthodontically or orthognathistically, because it causes damage to the temporomandibular joint. Side effects from muscle relaxants. I know that the patients who are given these drugs in a dental office or in an oral surgery office, or in that office in a teaching institution here in Nashville, Tennessee, are not given this list. Side effects: muscle relaxants, dizziness, constipation, confusion, weakness, depression, insomnia, upset stomach, frequent urination, drowsiness, nausea, seizures, difficulty urinating, difficulty breathing, nervousness, agitation, irritability, dry mouth, blurred vision, headache, hallucinations, fainting, pounding heartbeat, decreased blood pressure, and tiredness. Now, when I interview patients in a consultation, frequently I will ask them, are you on any medication for TMJ? And they will say, I went to blah, 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 and they gave me muscle relaxants. That's how I know. And I always ask them, how do you feel about the muscle relaxants? And most people kind of roll their eyes and say, well, they make me feel funky, make me feel bad. And they don't describe exactly what's going on. But those are the side effects just from muscle relaxants, unintended consequences. And it is the standard of care to make sure that the patient understands what the side effects are. So basically, what has been out there for 50, 60 years, and the treatment of TMJ problems with muscle relaxants goes back in my career all the way back to the beginning in the early 70s when I was in dental school. Muscle relaxants was the basic treatment of choice. Was the standard of care adhered to, and the patient given a list of all those side effects that can occur when they're on muscle relaxants? No, they were not. And no, they continue not to be. And I know not one of those patients who has come in to see us has been given a list of side effects that occurs when they're on muscle relaxants. And that is the standard of care, that you give a list of what the possible side effects are. Next one is botulinum toxins. They come in several varieties. I won't name the brand names. Botulinum toxins are 3 or 4 very, very common, one extremely common. By the way, botulinum toxins are not approved by the FDA for the treatment of TMJ problems in any way. They're great. They're great for your wrinkles if you want to use them. I encourage people, if you want to get rid of your wrinkles, put some Botox in there. It'll work. But not for TMJ, TMD. It is not approved by the FDA, and you're leaving yourself an open door to certainly be criticized one way or another. The liability increases significantly, but the botulinum toxin complications, unintended consequences, side effects include droopy eyelids, difficulty breathing, difficulty speaking, difficulty swallowing, neck pain, temporary facial weakness and drooling, double vision, heart problems, headache, loss of bladder control, nausea, eye pain, redness, bruising, drooling, hereditary muscle cramps, injection site complications, muscle weakness, vision problems, hoarseness, sweating, cervical dystonia, dry mouth, and sore throat. Next on the list would be corticosteroids. I had 2 or 3 cases within the past 2 or 3 months where a dentist here in the Nashville area is injecting steroids into the temporomandibular joint. And it is well known in the medical community that steroids inside a joint creates problems within the joint itself. But the side effects of corticosteroids, which are used routinely by both dentists and medical doctors, which I have seen profound numbers of patients coming through our practice have been placed on corticosteroids. Side effects, unintended consequences include acne, mood changes, diabetes, increased hair growth, depression, agitation, dizziness, indigestion, high blood pressure, osteoporosis, glaucoma, irritability, infections, colds, fluid retention, redness, insomnia, weight gain, hair loss, blurred vision, stomach irritation, decreased sexual desire. I think headache was already named. Headache. And skin changes. Skin changes very common. And so that's why if you're going to use steroids at all for any reason, they're limited in time. You can't use steroids very long in any way, shape, or form. And the length of time that you can use steroids, even with the potential side effects, is extremely limited in comparison to the length of time the temporomandibular joint symptoms persist, which is like years and decades. But I still see a lot of steroid used. Another common thing that is seen coming out of the physical therapy arena, physical therapist, because a lot of the complaints have to do with muscle tightness, right? The central nervous system, once it gets the signal, autonomic signal, that there's inflammation within the temporomandibular joint, the central nervous system at the level of brainstem sends out a signal, autonomic signal, that says muscles tighten up, and the muscles get tight, and it can be the muscles of mastication, the muscles of the neck, upper shoulder, and second most common symptom of TMD is neck pain. Upper shoulder and neck pain, extremely common, and goes on for years and years. And so the physical therapist used this technique called dry needling, which has some benefit in relaxing a muscle for a short period of time, very short, like days at most, in comparison to the length of time that these autonomic signals continue to come out and say tighten up, generated by inflammation within the temporomandibular joint. But the side effects of dry needling, as you might expect, the simple side effects would include bleeding and bruising and pain of the needling process. But the major side effects include nerve injury and infection and pneumothorax. And I bring that to your attention, and I have mentioned it in a prior episode, that I actually had a patient who came in who developed dry needling, because obviously this patient had TMD problems in our practice. She had all of the other symptoms: headache, earache, muscles of mastication pain, ringing in her ears, but she had a lot of upper back and shoulder pain. went to a physical therapist. The physical therapist did dry needling, and the patient ended up with a pneumothorax because the needle went, apparently a small female. If you have a lot of muscles, it's hard to get a needle all the way through the muscles into the upper lobe of the tongue, but allowed the air to go through the needle and created a pneumothorax, and that patient ended up in the emergency room with a chest tube in because of the pneumothorax. That's a serious complication. Again, I don't know for sure, but I doubt that physical therapist gave the patient a list, including pneumothorax as a possible complication. And again, that physical therapy treatment and dry needling is only attempting to treat the symptoms, not the cause. Cause being inflammation within the temporomandibular joint, creating the autonomic signals, creating the signal to tighten up the muscles. When you make the inflammation go away, the signals don't occur, the muscle relaxes. You don't have the tightness. You don't have the pain. And the last one we'll cover is neuroleptics, antipsychotics of various kinds. But they have significant side effects, as you might expect. And although not as common, certainly, as other medications, and I didn't look up Xanax and Valium because those are very, very common given to people for TMD, because the theory behind it is you're clenching and grinding. We need to relax you. You need to relax. So here's some Valium, here's some Xanax. I'll let you look up the complications, the side effects of Xanax and Valium. Very, very common drug to be used for people by both dentists and physicians, that they think that they can stop somebody from clenching or grinding their teeth by giving them a drug. We do not even understand the mechanism, how the mechanism within the central nervous system works with the clenching and the grinding. All we know, it is related to stress. It is related to anxiety. The more stress, the more anxiety, the more people tend to clench or grind. Half the population bruxes, clenches or grind. Most of them are not aware they do it. I had a patient just yesterday. She claimed at the beginning, there's no way I clench and grind. I'm a mouth breather. After about a month, she came in and was sheepish looking, and she showed me the device, and she had the usual war marks, and and she proved to herself that when she went to sleep at night, she's clenching and grinding. Half the population clenches and grinds. We don't understand the mechanism. The only thing we know, it is related to stress. And yeah, Xanax and Valium, for a while, they kind of make you feel better that you're not as stressed, and then try to get off of it after you've been on a while. The effect of trying to get off those drugs is horrendous. And the last one I'm going to cover here is the neuroleptics and the side effects of neuroleptics, which are really antipsychotics. And I have had many, many patients given some of these neuroleptics for their temporomandibular joint problems. And the side effects include dry mouth, blurred vision, cognitive impairment, constipation, delirium, urinary retention, akathisia, dystonia, which is the biggest one, tardive dyskinesia. Tardive dyskinesia. These patients that are on these drugs for any length of time, it doesn't take long, and they just have a constant motion of their lower jaw. Had a patient last week who exhibited that symptom after being on neuroleptics for many, many years. And we got her out of her pain. We got the TMD symptoms corrected. She had no more TMD. She was so thankful. I mean, I don't mean to boast, but I mean, she was so thankful. This just happened last week. But she, a very nice woman, she continued to do this all the time I was treating her, and while she was thanking me because all her symptoms were gone. That's another story. It's another, possibly another episode just talking about tardive dyskinesia and its relationship to neuroleptic drugs. Metabolic effects, hypercalcemia and diabetes, hyperlipidemia, weight gain, cardiovascular effects, ankle edema, arrhythmias, cardiomyopathies, myocarditis, postural hypertension, menstrual irregularity, sexual dysfunction, blood dyscrasias, hypersalivation, neuroleptic malignant syndrome, photosensitivity, sedation, seizures, skin pigmentation, and thyroid abnormalities. And those drugs, on occasion, are given for people who have TMD. And the question is a standard of care followed? And does that patient, are they aware when they take those drugs for the symptoms of TMD? Are they aware of what they're letting themselves in for, of possible complications, side effects, and unintended consequences? So you can see that if you follow the thinking, the logic of Dr. Robert Pearl in trying to persuade by his writings that we need to consider the aspects of value-based treatment, in this case, value-based TMD treatment, that it is important for us to consider that whatever that treatment is, that it has minimal side effects and unintended consequences. And if it adheres to those criteria, then it would be reasonable to say that that is a value-based treatment. I made my point. I hope I haven't intimidated you too much about talking the side effects. But if you're prescribing some of these drugs, you need to consider, number one, what the side effects are, number two, and most importantly, what the standard of care is, and to advise your patient exactly what the side effects are if you are prescribing any of these drugs. That'll be it for today. If you are interested in learning how to use this device and protocol for the treatment of TMD, which is very effective. If you'd like a copy of the independent university study validating what I just talked about, how effective it is to use a device that separates the posterior teeth according to the proper protocol. If you'd like to learn, if you'd like a copy of the study, you can contact me at tony@tmjservices.net. You can contact our Director of Operations, Dr. Naomi Williams, at naomi@tmjservices.net. If you'd like to get onto our website and learn more about what we do and how we do it, and a lot of other information, success stories, and just the whole the copies of my blog that I write one a week, that can be seen at our website, www.urbanictmj.com. urbanictmj.com. Until next time, I encourage you to get interested in treating TMD. The dentist, are the only people that can do it. The physicians have no interest in it. They will never have interest in it. And if you are going to do it, it's easy to do. It's not complicated. It's just about, it doesn't take a whole lot of time when you know how to treat it properly. And it's a practice builder. Once you get the patients to the point where they say, thank you, thank you, thank you, they send all their friends in to see you, or they say, can you be my dentist? It works out really well for everybody. Until next time, I look forward to our next episode, which I'll give you a little heads up on that. We're going to talk about sincerity of the provider and the caregiver. Obviously, the more sincere you are, the more value there is. So for today, I'm Tony Urbanic, and this is TMD Demystified.